Are biased, the Idaho Press Club are biased, all media, newspaper, radio.
To be completely blunt here, Brian, and there are plans to expand
indoctrination.
That's right.
Well, Idahoans are also concerned.
Horror shot. That line would be moving a little bit farther west.
I'm like crying.
Nobody wants to see
dark money is influencing policy in our state.
Well, that's not how this works.
Well, hello there and welcome to Nowhere to Hide. I'm Brian Hyde, and I'm going to do my best today to help you propaganda-proof yourself against what I'm sure is well-intended, but nonetheless propaganda that's being directed at us by much of our heritage media here in the great state of Idaho. Now, before I go into some of the topics we're going to cover today, I do want to take a moment here and just give a quick recognition of longtime Idaho lawmaker Senator Mark Nye, who passed away last Saturday at the age of 76. He was a Democrat from Pocatello, served in the state Senate, and actually apparently passed away after an extended illness. He was elected to the Idaho House back in 2014, and then 2 years later elected to the state Senate, where he served 3 terms. He announced earlier this year he wouldn't be running for re-election. And anyway, want to send our condolences to him and to his family. And interesting is I never knew Senator Nye. Did not know him on a personal basis, and so really I have very little to go on except what I'm seeing other people, his colleagues and people who covered him in the press, have to say about him. And I have to say, one of the most impressive things that seems to come out, one of the common threads that you see, is people talk about how, regardless of whether they agreed with him or not, they said he was a very decent person to work with. And there's I think the word trust comes up a couple of different times in people working with him, and isn't that interesting? That you could disagree with somebody, not see things the same way that they see them, and still have, the capability of trusting them or, working with them instead of being driven by, well, they're my enemy if they disagree with me. Anyway, it's a very interesting way of thinking. I'm going to do my best not to get you thinking in an enemy-driven way, but I've got a topic here that I think is going to hit a few people's hot buttons. This is a piece from the Idaho Capital Sun published yesterday. American public health institutions need to rebuild public trust. That's according to University of Idaho research. Now, I'll admit, I'm one of those people who has a big deficit of trust for public health institutions. And it wasn't always there. I mean, I was raised in a home. My mom was a dental assistant and my dad was a pharmacist. And so I was raised around people who were in and connected to the medical community. And, I had every reason to believe, if I go to the doctor, I'm going to get the help that I need. But I saw some things happen over this last couple of years. And the research that these researchers put out raises some very interesting questions. Maybe we could take a little bit closer look. If public health institutions want Americans to follow their lead, they will need to work on building the public's trust. That's what a study led by Idaho researchers suggests. A paper on the study was published in May in the journal PLOS One. The study was a collaboration between 8 University of Idaho researchers and 1 University of Texas Austin researcher. Importantly, it says, our research suggests cultivating trust in authorities tasked with communicating public health information would be the optimal way to increase behaviors that protect health, to slow the spread of future pandemics, the researchers wrote in the paper. Now, I don't know if you had any, misgivings about the things that you were told or the things that were asserted to be true that were later walked back or otherwise quietly revised, but there was a lot of wiggle room on the part of public health officials, and I'm not looking for a reason to condemn or throw anybody under the bus here, but I would like to see some responsibility. Where someone said authoritatively, well, I think of the guy from the Imperial College of London, whose computer model says, well, if we don't do this right now, if we don't take drastic action, we're going to see more than 1 million people dying in England and hundreds of thousands of deaths in a very, very short period of time. And he was off, and he was way off on his numbers. In fact, he actually got busted sneaking out of lockdown so that he could go have a dalliance with his lover. And it makes you wonder if that was just simple incompetence at work, or maybe overconfidence of stating something as a fact that wasn't known as a fact. But my point is, people have good reason not to put their firm, full-throated trust in some of these public health officials. Now, this particular survey looked at 1,034 households in Idaho, Texas, and Vermont. They surveyed them between October and December of 2020. At that time, the vaccines for COVID-19 weren't yet widely available. Public health officials recommended and continue to recommend what they call non-pharmaceutical methods to protect against the virus. Now, this is some of the stuff that you and I likely had to experience that we have later learned really did nothing in terms of slowing the spread of the virus. 2 weeks to flatten the curve. Things like masking, social distancing. But listen to this. A handful of groups in Idaho and elsewhere protested mask mandates and other public health orders and guidelines. Why do you suppose they did that? Could it be because they were just the tip of the iceberg of things that were being used to shut down people's lives and to ruin their mental health and to deny them access to their families or to otherwise arrest them for things that normally would never get a person arrested? Just a thought, something to think about here. Meanwhile, the article says, a surge of COVID-19 overwhelmed hospitals across the U.S. and nearly forced Idaho's healthcare system into a last resort triage protocol. I remember when this fear was very widespread about, oh my goodness, it's going to overwhelm the hospitals. And there were some hospitals that were quite busy. But there also were very long periods of time in which the hospitals were not overwhelmed and not even close to overwhelmed. So why is this trope still being used today to justify what was done in the name of those, attempts to do what they call non-pharmaceutical methods? The study found that Americans at the time made choices to reduce their risk of perceived threat. And the more they trusted public health authorities, the more likely they were to, get this, accurately judge their health risk and take actions to protect against disease, the researchers wrote. People in rural areas trusted government less and saw COVID-19 as less of a health risk than those in urban areas, however, had more trust in institutions and believed COVID-19 to be more of a health risk. I don't know why, but this kind of makes me think about a letter that Thomas Jefferson wrote to his friend Peter Carr back in, I want to say that was in 1787, in which he said, state a moral case to a plowman and a professor. And he says, the former will get it right more often than the latter, because he has not been led astray by artificial rules. So when they bring up the concept of, well, the rural people distrust government more and saw COVID-19 as less of a health risk, maybe there's something to this. Is it possible that people in more urban areas have more trust in these institutions because they have been misled by artificial rules? I mean, the people I talked to in rural areas did not downplay the fact that there was risk, but they weren't about to give up all the quality in their life in order to try to avoid that risk. And the part about accurately judging what to do and what the risk is, I mean, government can make recommendations. I'll explain more about why this is so important in just a moment, but I don't have a problem with government making recommendations, but the person who gets to decide what risk is acceptable and what isn't, that's you, that's me. So to portray it as well, that they only do it accurately if they're actively doing what these public health officials say, that's not necessarily true, because it is not a one-size-fits-all approach. This disease did not attack as one-size-fits-all. So let's not pretend that everybody should have been doing exactly the same thing. The article goes on to say, on average, rural Americans are older, more likely to live in poverty, have higher rates of chronic disease and disability, and are less likely to be insured than urban dwellers. Now, the trust deficit they identified creates additional vulnerabilities to COVID-19 in rural communities, they wrote. I'm having a hard time buying this simply because it seems like the rural communities were the first ones that returned to normal life, or at least I moved back to Idaho a little over a year ago after living out of state for nearly 25 years. And in preparation for that move, as I was looking for a place to live and making plans and traveling to and from the Gem State, that was one of the first things that I noticed, especially as I was traveling through and meeting with family and in some rural areas. I would go to meet with family, go to the gas station, the grocery store. We'd stop and have, dinner at a diner somewhere. And the thing that struck me was how normal people looked, how normal life was. faces not hidden behind masks, no fear in people's eyes if you happen to walk somewhere within 6 feet of them. They didn't obsess over, oh my goodness, I have to stay away from you because you're just a disease vector. And I have to say, that was a very big relief to see that there was, normalcy. Now, I know people who personally caught COVID and because of compromised immune systems died from COVID. So I'm not trying to downplay it and say that it ain't no thing. It's just, it was a great risk for some people, but primarily it was the elderly and those with compromised immune systems. Why should we pretend otherwise? And that's where I'm having a little bit of difficulty with the conclusion these researchers come to. The survey also asked people about the perceived threat of economic risk and risk to the community versus the individual. So some of the questions they were asking about a person's own behaviors were in settings where people around them do or don't follow public health recommendations. For example, if nobody in a grocery store was wearing a mask, would they? Now, this may sound like a humble brag, but I'm going to go ahead and say it. One of the happiest moments of my life was the day that I walked into a store with 2 of my sons, and it was still at a time when there was a lot of mask wearing going on, and a lot of people, would do it just because they didn't want to have friction. They didn't want to see the fear in other people's eyes. And, there were big signs, masks required for entry. We walked into a Cal Ranch store, and I was like, I'm not putting on my mask. We're not going to be here that long. I know we're going to go buy what we came to buy, and then we're going to leave. And so we did. We walked back, got our stuff, we went and we're checking out. But I watched as a guy came walking in from the parking lot. And I could see him digging in his pocket as he was coming through the front doors. And I knew darn well what he was doing. He's, getting his mask ready just in case he needed it. But as he walked through the door, I saw him glance around. And the first thing he saw was me, along with my 2 sons, standing there maskless. And he hesitated for just a second. Then he shoved his mask back in his pocket and went right on into the store and about his business. Now, I'm not going to, take single-handed credit for that was the day I saved the world, but he knew that it was okay, that he didn't have to play along with everybody else and put on the mask just because. And I'm not saying this from the standpoint of, if you wear a mask, you're stupid. I'm just saying it from the standpoint of it's a choice that people should have been able to make for themselves. But for some reason, it became a big power struggle on the part of people in power. That's a problem. Now, throughout the current pandemic, the article says individuals and groups have spread false and misleading information about coronavirus vaccines and treatments. Yes, I think I remember one of those about a year ago. A guy by the name of Joseph R. Biden, President of the United States, maybe you remember him, said something to the effect of, if you take the vaccine, you won't get COVID. Okay, he's been, vaccinated 4 times now? Boosted? Yeah, he's been looked after. I've seen him with the mask, even when, nobody else is wearing a mask, and now the president has COVID. So, yeah, there's definitely been some misinformation about the vaccines and even treatments. In Idaho, the article says some of those individuals have been elected officials or members of public health boards. Now, again, I want to come back to the idea that just because someone has a differing point of view doesn't mean they're out there spreading deadly misinformation. People who would say, well, the science is settled, or as Dr. Fauci says, I am the science, and therefore you have to do what I say, they don't understand science. Science is never settled. Science is always about asking questions, and that includes asking questions about, is this being handled the best way? It includes asking questions about, are drugs like ivermectin and hydroxychloroquine effective in treating COVID symptoms? And I'm not saying everybody has to take them. I'm just saying these are things that needed to be asked. People needed to work them out with their doctors, but you had people actively trying to remove doctors' certification or otherwise punish people for simply availing themselves of options outside of whatever the official public health policy said. And if this offends people, I'm sorry. My goal is not to offend you, but if it has to be one size fits all, if it's something that has to be coerced onto the population, maybe it's not really the best solution, even if your intentions are good. So the article says, in the case of COVID-19, trust in the message and the messenger has been undermined by several factors. Now, the University of Idaho researchers in their May journal article said, namely, there was a lack of uniform national, state, and local strategies. Uniformity, huh? Because Idaho's exactly the same as New York City, right? I mean, we're just all like right on top of each other, just exactly like you would find in any of those New York City boroughs. They talked about inadequate reach, accessibility, and consistency of public health information. and widespread misinformation and disinformation that was not adequately refuted. I don't know. They had the cooperation of virtually every legacy media source in the country. They had the cooperation of every social media source and all the various fact checkers and algorithms that would sort out and flag misinformation. And still they say they had trouble getting their message out because it just wasn't uniform enough. Again, I'm skeptical and I'm doubting here. But they say the study suggests that misinformation not only erodes trust in public health authorities, but decreases the motivation to seek and adopt correct information. And again, I have to ask, correct according to whom? Because I'm not convinced that they had the correct approach. And one of the things that makes me really wonder about this is, if that information was correct, why were there so many changes? Why was it that when the polling showed that, you know what, the citizenry is really fed up with lockdowns and particularly mask and vaccine mandates, suddenly that was when, wow, the science changed. And look, we decided we don't really need this anymore. Well, by that time, most people had stopped obeying these silly mandates in the first place. And so public health officials just tried to jump in front of a parade that was already going and tried to lead it. Well, look, we decided this is a good thing too. Back to the article. Government leaders and health authorities have changed their recommendations many times during the pandemic, often in response to what they call new discoveries, right? Polling in particular, shifting threat levels, new drugs and vaccines. But federal health agencies, particularly the Centers for Disease Control and Prevention, have drawn criticism and mistrust from all sides. From public health experts concerned about COVID-19 to, here it is, anti-vaccination activists who downplay the risks of COVID-19 to members of the general public. What if it isn't downplaying the risks of the COVID vaccine, but rather playing up the risk of government overreach to people's overall health far beyond what COVID was doing? Just a thought. The primary driver of how people act is what they perceive as the health risk to themselves. Now, I believe that's a true statement. And if I perceive that if I go out and there's a very good likelihood I'm going to get sick if I go to a very crowded place, guess what I'm going to do? I'm going to avoid crowded places. But that's a decision that I get to make. Benjamin Ridenhour, University of Idaho mathematics professor and lead author of the research paper, said in a news release about the study, one way that people determine that is by what the government is telling them. So it's important to have clear messaging. I don't know about you, but I have seen enough politicized, blatantly misleading information come from government that, frankly, when government says this is what you have to do or this is what you have to believe, I'm much more inclined to think the opposite until I've had a chance to check it out and vet it for myself. If they tell me the sun is shining, I'm sorry, but I'm going to have to go outside and take a look for myself because they do not have a good track record of dealing straight with people. And if you're one of those people who still believes, no, but really, they're operating in our best interest, I don't know what to tell you. Well, actually, I do know what to tell you. Hang on a minute. I'll tell you about another pandemic that happened within the lifetimes of many of us. So, in conclusion, the study added to existing evidence that pandemic-related behaviors align with political ideology. Now, I think that's only true if you can understand that this is one of the very few times in human history that a pandemic was politicized. That's why. But they say more than politics, trust in health institutions had the largest influence on a person's risk perception. So let's take a moment here and talk about a time in history, not so long ago, just, if you're 54 years old or older, you lived through the 1968-1969 Hong Kong flu pandemic. And that was a real, legit pandemic. The pathogen came in two big waves. There were many, many people sick, but there were no masks. There was no lockdowns. Traditional public health reigned just like it had during the flu pandemic that came through 10 years earlier. Life went on as normal. And this was the year that Woodstock took place. I mean, you want to talk about super spreader events. But the bottom line is this flu strain, H3N2, spread from Hong Kong to the U.S. According to the predictable timetable, it arrived in December 1968. It peaked a year later. And ultimately, it killed about 100,000 people in the U.S., mostly over the age of 65, and killed about 1 million people worldwide. Now, keep in mind, lifespan in the U.S. was about 8 years shorter than it is today. Population of the U.S. was only 200 million compared with 328 million today. And it would be possible, if it was possible, actually, to extrapolate the death data based on population and demographics. You could probably say we'd have been looking at roughly 250,000 deaths today from that virus. Now, we're not sure about COVID exactly because there was some exaggeration. As I've mentioned before, there were times where people who died with COVID were treated as if they died from COVID. But the bottom line is this was a legit pandemic. 1968 to 1969, it was deadly, it was scary, it killed more people than both the Vietnam War and the Korean War fatalities combined. But get this, you could still go to the movies, you could still go to bars and restaurants. You could go to a concert. How could they do that during a deadly flu pandemic? Stock markets didn't crash because of the flu. Congress didn't pass legislation. Governors didn't jump up to enforce social distancing. There was no curve flattening. The Federal Reserve didn't do anything. The only school closures were due to absenteeism. And even though hundreds of thousands of people were hospitalized, there was no banning of crowds or gatherings. No mothers arrested for taking their kids to other people's homes. No surfers arrested for being out there on the water by themselves. No daycares shut. Although there were infants that died from this virus, more, in fact, than died from COVID. No suicides, no unemployment, no drug overdoses that you could attribute directly to the flu. And here's the thing, media covered the pandemic, but it never became a big issue. The only action that government took during that Hong Kong flu pandemic was to collect data, watch and wait, encourage people to test, and to use vaccines where possible. The medical community took the primary responsibility for disease mitigation because it was just assumed, as with previous pandemics, that we need medical help, not political responses. And if you say, well, the government really wasn't involved in that much anyway, are you kidding? The late 60s? You had the Vietnam War, you had social welfare, public housing, Medicaid, Medicare. The president at the time was swearing to cure poverty, illiteracy, and disease. The point being, government was as intrusive as it had ever been in history, but nobody thought to engage in shutdowns. Interesting. So what was different this time? I don't know the exact answer. I'll hazard a guess for you, and I may be dead wrong, but I think that the difference this time was someone, maybe several someones, saw that by using lockdowns to a political advantage, particularly to punish or to hamstring the segments of the population that were, how can I put this nicely, not going along with the establishment. It wasn't just the deplorables. It was just it was a great way to assume control over great numbers of people, and this was both in the U.S. as well as without the U.S. Maybe that was just too much for someone who is a power seeker to resist. It sure happened in a lot of places. But the bottom line that you have to remember is all the masking, all the social distancing, all the ruination of people's lives and livelihoods and businesses, all the drug abuse and the suicide and the depression and the deprivation of being with family members did nothing to stop the spread of the virus. It did what viruses have always done. It spread through the population. The most vulnerable were the most severely affected. I think Governor Cuomo at the time in New York found that out the hard way, with tens of thousands of individuals dying after he ordered COVID patients to be moved into nursing homes, right where the most vulnerable population was. But we're expected to believe that what those public health officials were telling us, that was all good. And they know what's best. I'm not saying you should never listen to them. What I'm suggesting is you are the one who really has the most knowledge to make the choice as to how much risk you are willing to assume. So the best thing public health officials can do is give us straight information, give us good information. This is what they did in Sweden, by the way. No lockdowns, no mask mandates, nothing like that. And they certainly fared no worse than the countries around them that locked down hard. But they let people make up their own minds. If you feel like I'm going to be at risk and, you don't want to go out in public, then fine. Isolate yourself. Keep yourself out of the mix of people, as opposed to we're going to lock down any gathering over 10 people. And I only bring this up because you saw people arrested right here in Idaho for gathering and singing in church parking lots. You saw a mom arrested for taking her kids to the park. How can you justify something like this when it did nothing to stop to slow the spread of the virus. The virus did what it was going to do regardless. So trust public health officials, but I would say trust but verify, to paraphrase Ronald Reagan, because they may or may not always have your best interest in mind. And unlike elected officials who can be held accountable and may even try to gaslight you when you try to hold them accountable, Governor Little, I'm looking in your direction. We never locked the state down. Well, that never happened. What are you talking about? The ones who were appointed always seem to be passing the buck. Well, we were just following CDC guidelines. Well, we were just following these guidelines. Nobody wants to be the one to step up and say, you're darn right. I'm the one who said lock it all down, and I'm glad I did. That should tell you that definitely there are some second thoughts. And if someone's silly enough to bring it back and try to revisit it on the population, I mean, there's a lot of indications depending on where you live. Hopefully this is not taking place anywhere in the gem state, but in some sectors where the lockdowns and the school closures went on far beyond what they should have, the masks are coming back. Who knows? Maybe they'll be back to vaccine mandates as well. I don't know this. I mean, I don't know that this is something that's going to come to Idaho, but I do know this. I won't be playing along with it. And it's not because I hate people and want them to die of COVID. It's because it's very clear that what was intended, perhaps initially, as a response to a scary virus that we didn't really know which way it was going to go, turned into an exercise for keeping people under control of some political authority. And that's wrong. And it was harmful. And we're paying a huge price for having done it. How did it succeed, though? Okay. This is the part that may sting a little bit. I know I have to fess up and say, I was guilty of giving into the fear at first, too. Oh, well, if they say we better lock down, I probably better, lock down. If we had just found the courage to say no early on, and I mean it. No, I'm not going to go along with this. None of this would have been forced on us. All it required was enough people to say no. And that doesn't mean you were going to be reckless and out there, French kissing strangers and spreading the germs everywhere you go. But just recognizing that there are legitimate limits to what people in power can do. And people who have no legislative power should not be making decisions that are enforced with the force of law. Nobody should be taken off in handcuffs and sent to jail because they didn't put a covering on their face. I mean, it may sound harsh, but it really comes down to we were made to fear. That fear caused a lot of people to make very, very bad decisions. And because of that, people in power realized, hey, with enough fear, we can really manipulate the population, or at least large segments of the population, into doing whatever it is we need them or want them to do. So beware. Maybe it sounds like I'm preaching some fear right now. Fear the people who'd make you try to fear. I'm just saying, when you recognize that something is making you afraid, it's a good idea to ask yourself, okay, why is this person or why is this source telling me something that is playing to my fears? Because fear is a powerful manipulator. So on that note, let's consider a quote here from Bertrand Russell. Neither a man nor a crowd nor a nation can be trusted to act humanely or to think sanely under the influence of a great fear. Now you realize the opposite of fear is foolhardiness. But in between fear and foolhardiness, that's where you find that golden mean. I think Aristotle used to talk about this. There's extremes on either side really aren't where you want to be. You want to find that happy place in the middle. Courage is found in between fear and recklessness. So what we need right now are people who have the courage to know what they stand for, be willing to stand up, even if you're the odd person out, and to know when to put your foot down and say, that's not something I can do, or that's not something that I can go along with. Now, there are people in public health who I think are really trying to do the best they can to help the public in ways that would benefit it. But it's clear that there are a lot of people in public health or public health policy that got their first real taste of authority, and they liked it. They need to be limited as to the kinds of decisions that they can make and the kinds of power that they're able to wield over our lives. And business owners who are told you have to shut down your business or else, if they step up and say, not going to happen, they need to know that people like you and me have their backs. and we will stand with them, and we will support them. Hopefully this hasn't just roiled the waters and created a bunch more confusion. But keep in mind, it's your health. You best weigh the risks. You know what is best for you and for those that are nearest and dearest to you. Don't outsource that to someone, no matter how expert they may be. Do not outsource it, because there are some decisions that you have to make for yourself, and this is one of the big ones. I'm Brian Hyde. This is Nowhere to Hide.
Reporters are biased, the Idaho Press Club are biased, all media, newspaper, radio.
To be completely blunt here, Brian, and there are plans to expand
Indoctrination.
That's right.
Idahoans are also concerned.
Horror shot. That line would be moving a little bit farther west.
I'm like crying.
Nobody wants to see
Dark money is influencing policy in our state.